So here's an example of reactive neutrophilia. Reactive neutrophils are characterized by three classic findings. The neutrophils will have toxic granulation, toxic vacuolation, and Dolly bodies. In this field, we see a neutrophil at the center with toxic vacuolization, and the surrounding neutrophils, as well as pretty much every other neutrophil in this peripheral blood smear, has this coarse granulation characterized by these more basophilic appearing granules that are a bit larger in size. We also notice that there is a left shift in the neutrophil population. Here we see a myelocyte with its round nucleus and maybe a metamyelocyte. And left shift refers to the neutrophil lineage when it's laid out on a piece of paper, with the left being the most immature forms and the right being the mature multilobated neutrophils. Some of these neutrophils have characteristic Dolly bodies which appear at the periphery of the neutrophil. Here is a good example of a Dolly body. Dolly bodies appear as bluish inclusions of variable size in the cytoplasm of neutrophils, but can also be seen in eosinophils and monocytes. The inclusions may be single or multiple, as seen here, and are often located near the inner side of the cell wall and less often anywhere in the cytoplasm. These Dolly bodies represent remnants of rough endoplasmic reticulum or aggregates of denatured free ribosomes. Dolly bodies are generally associated with toxic changes, such as toxic granulation and toxic vacuolation, in conditions such as infections, burns, trauma, and GCSF. Dolly bodies without the accompanying toxic granulation and vacuolation are seen in cases of May-Heggelin anomaly and can sometimes be seen in pregnancy, myelodysplasia, and post-chemotherapy. The toxic granulation, compared to the fine light purple granules of normal neutrophils, toxic granules in neutrophils are larger and stain a more purple or dark blue. They resemble primary or xerophilic granules typically seen in promyelocytes. Toxic granules can be seen in some or all of the neutrophils and is associated with a variety of clinical conditions including severe infections, burns, trauma, and GCSF. Toxic vacuoles are round, clear spaces in the cytoplasm and represent sites of digestion of phagocytized material. Toxic vacuolation refers to the presence of a variable number of vacuoles in neutrophils and bands. They may be seen in some or all of the neutrophils, and occasionally are seen in eosinophils. These changes also accompany other toxic changes and are associated with essentially the same clinical conditions, such as severe infections, burns, trauma, and GCSF. Marked vacuolation is considered a characteristic finding of septicemia. However, it must be noted that degenerative changes resulting from storage of EDTA anticoagulated blood at room temperature also include vacuolation of neutrophils. It is not always possible to distinguish between toxic vacuolation and degenerative changes associated with the storage of blood.